Not surprisingly, the patient here again got some side effects secondary to the regorafenib, which are not really different from those of sorafenib. As you can see over here, the patient has a grade 2 hand-foot syndrome in addition to grade 1 hypertension. Appropriately so, patients should be on the antihypertensive, same way they were on the sorafenib for the antihypertensives. As far as the hand-foot syndrome, patient probably with one event only on the grade 2 will be watched and monitored carefully and with supportive medications. But if it is really to occur one more time, a little bit of holding and maybe dose reduction will be appropriate. But I think all in all here, this does not worry me. This is expected in a way and definitely manageable. Sorafenib and regorafenib appear to many of us as being the same drug with only one fluor added to the regorafenib. But I think this is really a much more complex comparison than that. Actually, regorafenib was built with that add fluor in purpose being there because it's energizing the drugs in a different way. The story, however, is much more complex than that. We don't know it yet incomplete, but we really know that there's certain targets that probably are kind of more of interest for the use of regorafenib after sorafenib, being like, for example, IGF and FGF. And we know that it's a multikinase, so it has an anti-IGF, anti-FGF factor as well. But more importantly, the story that we don't know yet completely are these targets specifically more of interest and more of importance after progressing on sorafenib. In other words, what did sorafenib do or contribute to the tumor to make it more prone to the regorafenib story? And that's really what the fascinating part of it, which many of us, including ourselves at Memorial Sloan Kettering, were working on that theory.